Good morning, dear students. I am Mrs. Priyanka Dikshit, working as Senior Assistant Professor in the School of Pharmacy, BBD University, Lucknow. Today we are going to study about the very important topic of pharmaceutical inorganic chemistry, hematinics. Let's start about the topic hematinics. Hematinics are the agents that tends to stimulate blood formation or increases the hemoglobin synthesis in the blood and are used for the prevention and treatment of anemia. What is hemoglobin? Hemoglobin is formed in the red bone marrow and it is conjugated with protein consisting of an iron containing pigment combined with histone protein. This iron containing pigment is known as globin. The iron-containing protein is a porphyrin consisting of four pyrrole rings. This porphyrin ring is designated as heme. Folic acid and vitamin B12 are capable of increasing the rate of heme synthesis in the blood cells or red blood cells. What is anemia? Anemia is a condition in which the blood is deficient in the RBC or erythrocytes in hemoglobin, or deficiency in the quality or quantity of blood refers to a disease condition known as anemia. Erythrocytes are mainly responsible for delivering the oxygen to the tissues. Less RBCs means less oxygen to the tissue, due to which blood formation or blood quality is decreased, leading to a condition known as anemia. Types of anemia. Basically, there are four kinds of anemia. First one is microcytic anemia. This microcytic anemia is caused due to the deficiency of iron. Second one is macrocytic anemia. This macrocytic anemia is caused due to the deficiency of folic acid or vitamin B12 that are needed for the absorption of iron. Hemolytic anemia. Hemolytic anemia is caused due to the abnormal breakdown of red blood cells. Aplastic anemia. Aplastic anemia is a kind of anemia where body stops producing new red blood cells, due to which deficiency of RBCs occurs in the body, leading to decreased quality or quantity of blood and disease condition known as anemia. Hematopoiesis. What is hematopoiesis? Hematopoiesis is the production of circulating erythrocytes, leukocytes, and platelets from undifferentiated stem cells. Requirements for the process of hematopoiesis. This process requires iron. Iron is needed for the formation of hemoglobin. Second one is vitamin B12 and folic acid. Vitamin B12 and folic acid are needed for the absorption of iron in the body. Hematopoietic growth factors are also needed for the process of hematopoiesis. Then proteins that are regulating the proliferation and differentiation of various red blood cells. Of folic acid. Daily requirement of iron. To make good average daily loss, iron requirements are for male adults 0.5 to 1 mg or 13 microgram per kg. For adult females or menstruating females, the requirement is about 1 to 2 milligram or 21 microgram per kg. For infants, 60 microgram per kg of iron is needed. For children, 25 microgram per kg of iron is needed, and for pregnant women, 3 to 5 microgram per kg of iron is required. Factors facilitating iron absorption. Various factors are there which are facilitating the iron or promoting the iron absorption in the body. These factors are acid. Acid enhances the dissolution and reduction of ferric iron and thereby increases the absorption of iron in the body. Reducing substances like ascorbic acid reduces ferric iron and forms absorbable complex and thereby increases the absorption of iron in the body. Meat also facilitates iron absorption by increasing HCl secretion or acid secretion in the body. Pregnancy or menstruation, due to increased iron requirement, increases the absorption of iron from the body. Factors impeding or inhibiting iron absorption in the body. These are phosphates. Phosphates are basically present in the egg yolk and these are inhibiting the absorption of iron in the body. Phytates occur in wheat and maize. Alkalis for non-absorbable complexes as well as oppose the reduction. Due to that, the absorption of iron in the body is inhibited. Tetracyclines also inhibit the absorption of iron in the body. Dietary sources of iron. Rich sources of iron are liver, egg yolk, oyster, dry beans, dry foods, wheat germ, and yeast. Medium sources of iron are meat, chicken, fish, spinach, banana, and apple. Whereas poor sources of iron are milk and its products and root vegetables. Iron deficiency anemia. Iron deficiency anemia manifests as hypochromic microcytic anemia in which erythrocytic mean volume or mean cell volume is low and mean cell hemoglobin concentration is also low. What are the causes of iron deficiency anemia? Iron deficiency anemia basically occurs in patients where increased iron requirement is there, like in infants or children during their rapid growth period, or in the pregnant or lactating women, or in the patients of chronic kidney disease due to increased loss during hemodialysis. Inadequate iron absorption is seen in gastrectomy, where all the parts of the stomach are surgically removed, and in generalized malabsorption, and in females where menstrual bleeding and during postmenopausal period. Treatment of iron deficiency anemia. For the treatment of iron deficiency anemia, various oral iron preparations can be used, and these preparations are basically taken in the form of salts like salt of ferrous sulfate, salt of ferrous gluconate, and salt of ferrous fumarate. Parenteral therapy for curing iron deficiency anemia involves iron dextran injection, sodium ferric gluconate injection, or iron sucrose injection. But these iron preparations are having uh, various adverse effects, that like they are causing epigastric pain or discomfort or cramping in the stomach, heartburn, heartburn or burning sensation, nausea, vomiting, staining of teeth, metallic taste, bloating, colic, and constipation. These are various adverse effects or side effects that are seen with various oral iron preparations taken for the treatment of iron deficiency. Types of anemia. Basically, there are four kinds of anemia. First one is microcytic anemia. This microcytic anemia is caused due to the deficiency of iron. Second one is macrocytic anemia. This macrocytic anemia is caused due to the deficiency of folic acid or vitamin B12 that are needed for the absorption of iron. Hemolytic anemia. Hemolytic anemia is caused due to the abnormal breakdown of red blood cells. Aplastic anemia. Aplastic anemia is a kind of anemia where body stops producing new red blood cells, due to which deficiency of RBCs occurs in the body, leading to decreased quality or quantity of blood and disease condition known as anemia. Hematopoiesis. What is hematopoiesis? Hematopoiesis is the production of circulating erythrocytes, leukocytes, and platelets from undifferentiated stem cells. Requirements for the process of hematopoiesis. This process requires iron. Iron is needed for the formation of hemoglobin. Second one is vitamin B12 and folic acid. Vitamin B12 and folic acid are needed for the absorption of iron in the body. Hematopoietic growth factors are also needed for the process of hematopoiesis. Then proteins that are regulating the proliferation and differentiation of various red blood cells. Reactions or chemical reactions of ferrous sulfate. On heating ferrous sulfate, first it loses its water of crystallization and the original green crystals are converted into brown colored anhydrous solid. When it is further heated, the anhydrous material releases sulfur dioxide and white fumes of sulfur trioxide, leaving behind a reddish brown iron that is known as iron oxide, and this decomposition occurs at 680 degrees Celsius where iron sulfate loses its identity to form ferric oxide sulfur dioxide. Iron sulfate also acts as a reducing agent, such as it is involved in various reducing or reactions, like it reduces nitric acid to nitrogen monoxide and chlorine to chloride. The reaction is as shown. FeSO4 reacts with nitric acid in the presence of sulfuric acid to form iron sulfate nitric oxide with water. Also, ferrous sulfate is reacting with chloride to form ferric sulfate and ferric chloride. Upon exposure to air, it also acts as oxidizing agent and it oxidizes to form a corrosive brown yellow coating of basic ferric sulfate, which is an adduct of iron 3 oxide and iron 3 sulfate. Ferrous sulfate reacts with oxygen to form ferric sulfate and ferric oxide. Uses. Ferrous sulfate is used as hematinic agent and due to which it is used in treating various disease conditions like in the treatment of iron deficiency anemia. Ferrous sulfate is also used by the manufacturers of inks. Notably, it is used in iron gall ink. Woodworkers use ferrous sulfate solutions to color maple wood a silvery hue. In horticulture, it is used for treating iron chlorosis. Ferrous sulfate is sometimes added to the cooling water flowing through the brass tubes of turbine condensers to form a corrosion resistant protective coating. Ferrous sulfate is also used in gold refining, and ferrous sulfate or green vitriol is also used as a useful reagent in the identification of mushroom. Thank you, dear students. Hope you all understand well the topic hematinics. For further questions or assistance, ask.